I don't think anybody should be forced to wear a mask anytime, anywhere. Masks should be a choice, and for those who choose to wear it, that's great. But this country is founded on the protection of choice, of freedom. And so if you feel like your health is in danger, you are absolutely welcome to wear a mask, but nobody should be forced to wear anything against their will. We don't hire politicians to be in and put them in charge of our health. They're in charge of protecting our freedom. We're in charge of protecting our health. It's a personal agency principle that has been violated by forcing anybody to wear a mask.
I do believe students should wear masks. There's a lot of controversy surrounding this topic. Recently there was a study done by BYU, and it was conducted not because anybody approached them. It was mainly because they realized that there was a need for people to know about masks. The research that had been done before was outdated. Anything really in regards to the pandemic is outdated almost on a daily basis. But BYU conducted a study in which I believe it was 75,000 people that was part of their study, and they certainly proved that masks are effective.
One of the signers of the Declaration of Independence and the Constitution was Dr. Benjamin Rush. And he was concerned about this. This was over 200 years ago. But he knew that the government would have a tendency to overstep and step on our civil liberties, which they have in this case very much. But he said this: unless we put medical freedom into the Constitution, the time will come when medicine will organize into an undercover dictatorship. That's what I believe this is. It's become an undercover dictatorship.
We have reported a number of positive cases to the state. We have also reported a number of students that have been in quarantine, meaning that they've been in close contact at school with somebody that has been tested positive for COVID-19. Then we reported numbers on the number of students who tested positive while in quarantine. And that number is not very high. So that shows the efficacy of masks. Even though our numbers are going higher and have stayed high for over a month now, where we have seen a larger number of increase in cases is through social interaction. So it seems that the school itself, it's not a place where you really could be more likely to get COVID, even though you have hundreds of students. But when you have hundreds of students wearing a mask, then that decreases the chances of you catching the virus. But the moment you leave the school and you go to your friend's house and you're not wearing a mask anymore, then you have a bigger chance of getting COVID-19. When you go to a birthday party, when you go to a family gathering, that really is where the larger number of cases are coming from. Not to mention work, especially factory jobs where people have to be in close proximity for hours at a time. Usually that's a place where people could get sick, even more than at school. But again, it's not as high as those social interactions that people are having in which they're not wearing masks. So yes, in the school setting where we are mandated to wear a mask, we are seeing the benefit of doing so.
You have a 98% chance of never even getting COVID, and a 99% chance as if you that if you do, you'll recover. Therefore, what would a vaccine do? Why would we even need one? But someone's going to make a lot of money on a vaccine. In fact, many companies will. In fact, anytime you see a crisis, you have to ask yourself, the phrase is cui bono, who profits? Who profits from creating this crisis? And that's the question that you need to always be asking, is who's profiting from this? You don't control people through socialism and communism. You just control them through fear. Those two things come as an extension of that. And so, if they want to control us, all they have to do is inject a fear, founded or not. And that's what's happened here.
Obviously, there's not research based that will yet evaluate how this is going to affect us emotionally, the wearing of masks. There just hasn't been enough time and a lot of focus put on that, because right now the focus is on preventing the spread of the virus, which is highly contagious, which in some cases kills people, and in some other cases debilitates others. So there's been a greater focus put on that. I do believe that after they have that under control somewhat, that they're going to spend more time on studying the social and mental effects of the pandemic. I'm sure they're working on it now. I just haven't seen studies reflecting any results on that. What I do want to say, as far as the well-being and the social aspect of students, is that we here in Utah, we are actually very lucky to be able to have face-to-face school. Many states in the United States have not reopened. So we are one of the few that have managed to reopen and have students come to classes and do face-to-face learning. And that gives the students the ability to interact with each other, to be in school with their friends, even do after-school sports. So I think overall we're doing well. And masks is what's allowing us to keep our schools open.